Tulsi Shanrai Foundation Eye Hospital is a specialty eye hospital providing state-of-the-art eye care in Abuja at affordable prices. Revenue from every patient who can afford to pay for getting his or her vision restored is used to give the gift of sight to those who cannot afford to pay. The hospital is open from 8:30 in the morning till 4:30 in the afternoon on all weekdays and till 12:30 in the afternoon on Saturdays. The first point of contact is the MRD nurse at the hospital reception, where the patients are given a pre-printed form to fill in their demographic details. The nurses on the reception counter enter the same in the hospital database. After this is done, a medical record number (MRN) is allotted to the patient and a registration card is issued. The patient is advised to move to the outpatient department to complete a comprehensive eye examination. The examination is spread over 3 check areas. The first is at the refraction room, where the test is done by an optometrist. The second is at the investigation room, where ophthalmic nurses record the patient's vitals as well as the intraocular pressure. The third section is consultation chambers, where the patient is seen by an ophthalmologist who will conduct detailed visual examination of the eye using advanced machines. The doctor gives a prescription or advice to the patient towards the next steps. The ophthalmologist's prescriptions usually indicate 4 types of advice, which varies from patient to patient. Those patients with a recommendation for optical glasses go to the in-house optical shop. Those patients who are prescribed eye medications procure the medicines at the in-house pharmacy shop. In the event the patient is advised additional investigations like the visual field check on the HFA machine or a study of his optical nerve on the OCT machine, or a B scan, these are handled by the assigned ophthalmic nurses on duty in the relevant section of the eye hospital. The patients also have the option to have a quick bite at the canteen within the hospital campus. Those patients who are advised surgical intervention meet the hospital counselor to get an appointment date for the surgery, as well as find out the options and costs for the surgical procedure. On the appointed date, the patient revisits the hospital for the prescribed surgical procedure like cataract surgery, pterygium or intravitreal injections. Patients prescribed to undergo surgical procedure for glaucoma and other ailments needing laser therapy are led to the YAG laser unit for their treatment by an ophthalmic surgeon. Patients coming in for any prescribed surgical procedures arrive in early on the scheduled date and report at the main hospital reception area. The patients make the necessary payment and are then given the prescribed green bands by the MRD nurses. This way they are accepted for the day's surgery and their papers move to the nursing staff in the surgical procedure section of the hospital on the first floor. The patient is escorted by an ophthalmic nurse for their procedures to be completed in the well-equipped operation theaters of the hospital. Post-surgery, the patients recover in the deluxe room if they have booked a room for themselves or the air-conditioned multi-bed wards.
The surgery was successful, it was nice, it was great. I believe they are the best for now, and I believe they have the answer to all eye problems. So to me, they are the best.
The patients need to come again for a review the next day. The TCF Eye Hospital is staffed with Nigerian eye care professionals who have received an 8-month intensive training at the Aravind Eye Care System in India. TCF Eye Hospital is located at number 505 Oladipo Dia Street behind the National Stadium next to House on the Rock Church in Abuja. You are welcome to visit the TCF Eye Hospital to witness the quality ophthalmological services available at this hospital. Paying the affordable fees for the various procedures goes a long way in serving the underprivileged indigents. It is essential to have one's eyes comprehensively examined once every year, irrespective of the age of the person, to detect ailments early and initiate corrective actions.